As always, we are at a bit of a crossroads. So today we've got Greg Kesterman, our health commissioner, with us. He will be the bad news portion of the program today. And we've got Holly Chrisman, who is the assistant to the county administrator, and she's with the good news today. So we'll get to that in just a moment. But as I said, I don't know how many of you are following Governor DeWine's press conferences. But we have an upward trend in the state. We have an upward trend in the country for positive cases, and we're seeing the same here in Hamilton County. So let's run through the numbers quickly, and Greg will expand on this. So our total number of positive cases in Hamilton County is at 14,907. The increase from last week, 954. Hospitalizations stand at 1,205. The increase from last week is 38. And the number of deaths in Hamilton County is 337. The increase from last week is 5. For those of you that are keeping track of these numbers, and particularly the week-over-week increases, I'm going to highlight one of these for you, and it is the top one, the positive cases. We were seeing a trend where we were in the 600s, the 500s, high 400s. Last week we were at 613. That was the week-to-week increase. This increase this week is 954. So it's a significant jump. And the hospitalizations are trending up as well. Death counts, as you know, are a lagging indicator, so we expect those to go up here in the next couple weeks as well. As fall and winter begin, we should expect to see cases and hospitalizations increase. The virus will not go away until we have a vaccine, but we can reduce the spread of the virus and save lives in Hamilton County. If we could get compliance up to 80 to 90% in Ohio for mask wearing, we could dramatically change the trajectory of the next several months. If we don't, things will get worse. But we know what to do. Wash your hands, wear a mask, practice safe distancing. Today, Greg Kesterman will fill us in with more details on the spread and the numbers, the data that's driving the conversation that we need to have in this community. Then Holly Chrisman, Assistant County Administrator, will give an update on the CARES Act funding, including updates on the small business program, rental assistance, and a new program to help with internet connectivity, arts funding, and more. Before I hand it over to Greg, I've just got a couple of quick update items. The Hamilton County Library, in partnership with UC Health, the Health Collaborative in Hamilton County, will be offering free COVID-19 testing at select locations. Testing will be offered on Fridays and Saturdays. I'm going to suggest that you go to these locations to get the detail because I don't have specific times for specific days, but the locations are in Avondale, Covedale, Norwood, and the West End. This testing is free. You don't need an appointment, and it's walk-up testing. In addition to that, there are many test sites that are opening up throughout the county through this partnership with the CARES Act dollars. So Hamilton County, Test and Protect, which is the Health Collab, and other partnership agencies. So if you go to thehealthcollab.org, Test and Protect, you're going to find a list of all those sites where you can go up and get a test. Going to give you an anecdotal story. So on Sunday, I thought, it's so helpful when you actually go out to one of these sites to get a better understanding of how it's going, how many people are turning out, how smooth the process is. And periodically I do like to get tested. So this is the second test I've had. So I went out to the Word of Deliverance in Forest Park. Bishop Bobby Hilton is the bishop out there, the leader of the congregation. And so it was after the services. There were cars lined up. There were also walk-up testing. There was walk-up testing going on. And so I did a walk-up test at Word of Deliverance on Sunday afternoon. They could not have been more friendly. The people that were administering the test were delightful. I filled out a little bit of paperwork. The volunteers from the church were guiding people. They were very kind and very nice. And so I got my test. So I got an email 2 days later. I've got it with me. So remember, I got the test on Sunday afternoon. On Tuesday afternoon, I got an email that said TAP COVID testing results. I tested negative, thankfully. But that's just how easy this is. I didn't pay anything for it. It was a 2-day turnaround, and I got my results. So I do want to encourage people who have not yet been tested or who feel like they may have been exposed or have been in a congregate setting, please go and get tested. This is how we're going to reduce the spread. If I had been positive, obviously, I wouldn't be here today. I'd be here virtually. So it's just a really easy thing to do, and it's for the good of the community. A couple other things. The census ends tomorrow. I know we've kind of talked about this in the past, and it's been a little confusing. But now we know that the census ends tomorrow. So if you haven't filled it out, my2020census.gov, fill it out today. The Supreme Court allowed the Trump administration to end the census on October 15th. Our self-response rate is 68%, and that's only slightly higher than where we were 10 years ago. We know that population has grown through the census. My2020census.gov. And one last note about the elections. As you know, people are voting at the Hamilton County Board of Elections. They're either voting early in person. Many people are dropping off their absentee ballots in the drop box. Some people in the community are putting them in the mail and getting them to the BOE in that way. But we have had, again, a pretty confusing understanding about, can we have more than one drop box? Where does it need to be? Can we do it in a different way? And so the most current information on this is that while we have one drop box on the property of the Board of Elections in Norwood, and that line to drop off in that drop box can get long during the day, there is now a second site being set up. It's not a drop box. It's two people, one Republican, one Democrat, that will be set up on property nearby. You can drop your ballot to them, and they will take it over to the Board of Elections. They are staff members of the Board of Elections, and so they will collect those ballots just off-site to try to relieve some of the congestion and take those ballots then over to the Board of Elections. We at the county have said, hey, to the folks at the BOE, if you need help making it easier for people to vote and the lines shorter for people to drop that ballot off, we're here to help. And so we have allocated some CARES Act dollars for this purpose. They were allocated a while ago, and so now we have sent a letter to the BOE just as a reminder. You know, if those dollars aren't sufficient, please let us know. But don't forget that we stand at the ready to help that voting process be as accessible as possible for the people throughout Hamilton County. So that is the end of my my commentary and my updates. So with that, I am going to turn it over to Greg Kesterman, Hamilton County Health Commissioner.
Good morning, and thank you, Commissioner. So over the last 7 days, we have seen COVID-19 cases and hospitalizations increase fairly significantly. I really want to impress everyone that we need to not let our guard down at this time. We need to stay vigilant. We know there are several vaccines and treatments in development. This will eventually provide a solution, but we are not there yet. We need to continue to work together. We must continue to realize that we have to live with COVID-19. We have the ability to keep COVID low in our community. We've actually done it once, so I know we can do it again. Remember, if you have symptoms of COVID-19, I want you to go get tested. Commissioner Driehaus just shared an example of how easy it is to get tested in our community. Our website, we continue to maintain with a complete list of test sites. It also has a link to the Health Collaborative's Test and Protect program. Those sites are listed on our website. They're also on their program or on their website. Remember, if you get tested, if you are symptomatic, we are asking you to stay home until you get those test results. Or if you have a known exposure to someone, we want you to stay home until you get those test results. If you're asymptomatic and you're just getting tested because maybe you attended an event that had more people than you were comfortable with, you're allowed to go about your daily business until you get those results. But if you're symptomatic or had a known exposure, it's extremely important that you stay home until you have your results. Let's start looking at some of the case data now. So these are our positive COVID-19 cases. In last week's press briefing, I shared our agency and the city of Cincinnati were seeing about 80 cases per day. We are now up to about 120 cases per day over the last week, so a significant jump in cases. These cases are coming from the community. There's not one specific source. We know that they are not from super spreader events. They're from people going shopping and being careless. They're from gatherings after work or on the weekends. They're from sporting events. They're from schools. They're from nursing homes. They're all over in our community. There's not one source that's leading to this increase. Over the last 7 days, I took a peek at some of the demographic data. There were 200 cases from the 18 to 29-year-old age group. So just a reminder to those folks that fall within that group, it's super important that you're extra careful right now. While you might not experience the worst of the sickness, you might have some symptoms and you might not get hospitalized. As that disease travels to parents and grandparents and other elderly individuals, the impact is much more great. There was a fairly equal distribution of positive cases in the last week between males and females, which is kind of how it's been throughout the pandemic. So looking at the reproductive number, we are at 1.33 today and 1.26 for the region. We had been for a long time hovering just around 1 or just below 1, so this is a little disheartening to see. Any number above 1, you may recall, for the reproductive number means we're kind of expanding the pandemic. So we need to work a lot harder at controlling our cases by doing those very basic measures: wearing a mask, staying home if you're sick, washing your hands, and social distancing. That is how we control COVID-19 here in our community. On hospitalizations, when you look at those within Hamilton County itself, for the residents we're tracking, hospitalizations remain fairly flat, which is a good thing. Although when we see cases increase, we know deaths and hospitalizations will eventually increase because they are a delayed indicator. When you look at hospitalizations for the region, which is very important to do because our hospitals are a regional asset, people come from all over the region to use our hospitals, there is a significant increase in the number of cases. It's very dramatic. You can see it in the bottom right graph. It just shoots straight up. So this needs to be a reminder that COVID is here and we need to continue to work hard to keep those numbers in check. And finally, when you talk about our intensive care units, intensive care unit admissions, these are delayed as well. They are starting to increase, but at a much slower rate. As mentioned, though, this would be another delayed indicator. So as you start to see hospitalizations occur, eventually you'll start to see intensive care unit admissions increase, and then ultimately you might see deaths increase as well. So just to reiterate, we are not alone. Cases are spiking around the country and the state of Ohio. Let's continue to be leaders here in Hamilton County to help control COVID in our communities. I realize that this will be more difficult as we start to head inside for the winter, but we need to continue to be creative. Our plans for Halloween or other fall activities, we need to adjust those this year. And now's the time to start planning for those events to make sure that as we're sending our children out into the community on Halloween or as we're planning Thanksgiving, we're able to keep our families safe. We can do this. We've done it before. We really flattened the curve very well in Hamilton County. And actually, I've been proud of the work we've been doing here in Hamilton County. When I hear other health commissioners throughout the state talk about what their grocery stores look like when they go out on the weekends, It's nothing like ours. Ours are 95% individuals in the store wearing their masks. In some other parts of Ohio, we are not seeing anywhere close to the same compliance. So I appreciate everyone working hard to make this a reality. We just need to tweak what we're doing after work and tweak what we're doing on the weekends and make sure that we're still being very cautious with our families. When we let other families into our circles, we need to continue to be cautious, because that is how COVID-19 is spreading. It's spreading from person to person, and it's in these places where we're letting our guard down. Continue to keep sick at home, continue to social distance, wash your hands, and please wear your masks as often as possible when you're near others. These are the only tools that we have until we have a vaccine. We are at a critical moment. If we work hard, we can absolutely control COVID in this community. Thank you.
Thank you, Greg. So, and thank you for reminding us that we've been through this already. And we did flatten the curve here in Hamilton County. And I want to remind folks that while there are people in this county that are not wearing masks, and they don't want to wear a mask, they've chosen not to wear a mask. That's not great for any of the rest of us, by the way. But anyway, those individuals are in the county. But that's not really what we're talking about here. We're talking about individuals who, in the workplace perhaps, or in the grocery store, or when you're out, you are wearing a mask. You are doing the right thing. You're protecting yourself. You're protecting other people that are around you. But it's when you're in these smaller settings, when maybe you're in your home, and unlike a few months ago, people are having people in their homes to watch a ball game or to celebrate a birthday or whatever it is. And that's what's happening when people are letting their guard down, not wearing the mask, and getting near one another. That's the problem, right? That you're not thinking, oh, this is a situation where this might spread. It is a situation where the disease could spread. And so that's, I think, the reminder that the commissioner is trying to tell us, is that we need to be vigilant all the time. And for those of us that are pretty vigilant about wearing a mask when we know we need to, we also, in those kind of circumstances, need to be vigilant as well. So thanks for that message, Greg. So Holly Chrisman, Assistant County Administrator, is next. We have talked a lot about the CARES Act dollars. And by the way, it's been very difficult to track what's going on at the federal level. We have not seen an additional package come our way. We don't know if that's going to happen by the end of the year. We're hopeful that it would, because it would provide more resources and a time extension for spending these dollars. That said, we're not there right now. We've got a finite amount of money. We have to spend it by the end of the year. And so Holly is going to give us a snapshot as to how we're doing and kind of a reminder of where those dollars have gone. And a few programs have recently come online, and so she's going to highlight those programs. Thanks, Holly.
Thank you, Commissioner. Good afternoon. As you all remember, Hamilton County was a direct recipient of U.S. Treasury dollars through the CARES Act. We received $142.6 million. And back in, I believe that was April, it seems like 8 years ago, we received that, quite frankly. And just as a reminder of the guidance we received on those dollars, we were asked basically three questions. Is this expense necessary due to COVID-19? Was it already allocated in your most recently approved budget? And as Commissioner Driehaus mentioned, you have to spend the money between March 1st and December 30th of 2020. That was our initial guidance, as well as some frequently asked questions. So as we've gone over the past few months, we have received updated information from the U.S. Treasury on how these dollars can be spent. But back in April and May, the Board of County Commissioners directed administration to provide us guidance on how they would like these dollars to be used. And that culminated in a plan in early June on how these dollars would ultimately be spent. As you can see, we had 4 buckets. We had funding available for public health initiatives, funding for vulnerable populations, funding for community and economic assistance, and funding for internal county operations. Next slide, please. So I'm going to go through just briefly how we're doing and highlight, as Commissioner Driehaus mentioned, a few programs. So for our public health category, you can see the largest is our COVID-19 testing program, followed by PPE. Next slide, please. So just a few highlights of that bucket. We've talked extensively about our incredible partnership with the Health Collaborative and all of the health system partners in our region to really expand COVID-19 testing. And we're happy to see that program ramping up quite significantly now. And Commissioner Driehaus, I want to just add to your story. I had a dear friend of mine who went to our sites on Monday and got tested and said it couldn't have been easier and quicker. She was shocked at how fast she had that test done. So again, I want to reiterate what Commissioner Kesterman also mentioned of please use these sites. They're there for you. The website is there as well. So we have $18 million allocated for that program. In addition, what we have found is when residents are tested, there may be a need for them to not work while they're waiting for the test result. Or if they are tested positive, they have to obviously quarantine and take care of themselves and not work. There may be a need for those residents to have some services such as food delivery or rental assistance, medical supplies. And so we're grateful for a newer partnership with United Way, who is helping to provide those wraparound services. So how this basically works is if you go to one of our test sites and you might need some social services assistance depending on your test result, a United Way care coordinator will reach out to you if you want them to and find out what your needs are and then get in touch with the appropriate service provider to provide that need. We're again grateful for that strong partnership with United Way. In addition, obviously, we've talked about the need for personal protective equipment. Our team at Hamilton County Emergency Management Agency is busy making sure that our partners, local governments, fire departments, healthcare organizations have the appropriate PPE available to them. And as you can see, we've helped, I mean, this number changes every day, so the last number we have is we've helped at least 425 organizations with PPE, and that ranges from masks to gloves to gowns to cleaning products and hand sanitizer. And then the last program I want to highlight under public health is our pandemic child care provider reimbursement program. Again, going back to March, the state of Ohio had a temporary pandemic license for child care providers, so they could operate from March through the end of May, really to help serve those frontline workers and health workers. You can imagine, though, the additional costs to provide that service given social distancing and extra cleaning. And so we worked with 4C to put out a program to help reimburse programs for those increasing costs. And we're getting very close to awarding, we anticipate at least 80 organizations with some reimbursement for those expenses. So those are just a few highlights of our public health. For vulnerable populations, you can see the largest category is our homeless sheltering. Next slide, please. Just a few highlights on that. This was the first program, again, going back to late March, early April. We had a very quick call with Strategies to End Homelessness and our other homeless providers saying we needed some help. We're struggling social distancing in our shelters. And so that was one of, if you remember, Commissioner Driehaus, one of the very first actions we took very quickly was to provide funding to allow homeless residents to have safe social distancing, follow CDC guidelines by providing hotel rooms. That was a program, as you can see. We have a quote from Kevin Finn, president of Strategies, with his thanks for that initiative. We have $1.1 million we've allocated for that program. Also under vulnerable populations, the Board of County Commissioners ensured that we wanted to make sure we had funding set aside for domestic violence response. This is, as you can imagine, we've all heard the stories about increase in needs, especially for many of our nonprofit service providers. And this is one we wanted to be sure we carved out money specifically for. And so through our nonprofit program, which I'll talk about in a few minutes, we have provided funding to the 3 organizations listed: Women Helping Women, Franciscan Ministries, and YWCA, specifically for domestic violence response. I know just to point out, Women Helping Women in their application to us stated that they had an increase in their Hamilton County clients by 23% from mid-March through June. And so these funds will help reimburse them for those increasing costs. We're again proud of this partnership with these 3 organizations. We also then have our county operational response category. You can see how those funds are broken out here, or allocated here. I would be remiss. There's many people I want to thank, of course, but our county facilities team has stepped up like you couldn't believe over these past few months. We have provided reimbursements to county facilities to help our buildings reopen safely to the public. Think about our courts. Think about our county administration building here to allow people to come in and get the services they need. So when you come to our buildings, you're going to see lots of plastic barriers. You're going to have temperature checks. You're going to have appropriate signage and distancing markers. And that was all thanks to our team at Public Facilities. And those are how some of our funds are being used from the CARES Act dollars. And then our last category, which is a big one, we could talk for quite some time about this bucket of funding, is our community and economic assistance. You can see we have a wide range of programs, and the list has grown recently over the past couple of weeks. So again, a couple to highlight here. I mentioned our homeless program was one of the first that we launched. Second was small business. Third, I believe, was rent and utility, if I'm remembering the order correctly. So we really tried to hit those basic needs as quickly as we could out the gate. So our rent and utility relief program, as of last week, so we'll have new numbers tomorrow, at least 700 renters have been assisted. We have 3 providers that we're working with to administer this program. There's a big demand, as you can imagine, for this program, so we are looking to bring on a 4th agency to help with that demand, and that will hopefully be coming shortly. The small business program I mentioned, we launched the first round in May and awarded, as we've reported previously, 217 businesses in the first round. We have launched the second round and are currently having businesses sign agreements. We have 451 in this first tranche of our second round that will be receiving funding. It's about $4 million. And we have another batch of applications in their final review stage. So we have $7 million, $7.5 million available for this program, and we're going to be really close to hitting that mark. So really grateful for the folks at HCDC that have helped us put this program on. And then I've mentioned that the nonprofit grant assistance. We, as you can imagine, the increase in costs, the increase in service demand due to COVID-19 for our nonprofit partners has been astounding. And we launched a grant program where we will be funding 93 nonprofits in the amount of roughly $5 million to help with their increased costs and increased service demand. Those of that amount, approximately $1 million will be going towards youth-focused programs as well. But you can imagine some of the nonprofits that we're funding range from mortgage assistance. Food is a very big one. Food distribution. We've talked about the youth-focused programs. Remote learning are all programs that we're funding through this program and through the CARES Act that, again, would not be necessary if it weren't for COVID-19. So I'm also, I mentioned we're adapting. We've adapted. I can't tell you how much we've changed since March. And I'm grateful for the commissioners and all of our team working on this program for their bendability in responding to needs and keeping an eye on what needs to happen to help our community recover from COVID-19. And so a few that you may not have heard about yet, we have partnered with ArtsWave. We have launched a grant targeted to nonprofit arts organizations. As you can imagine, according to ArtsWave, about 10,000 people are employed in arts throughout the region, with the bulk of those being in Hamilton County. And as we all know, many of them had to shut down or had to significantly reduce their operations due to COVID-19. So this program will assist those organizations with costs incurred due to the pandemic. Those applications are online now and are due on October 23rd on ArtsWave's website. We have $3.5 million allocated for that program. So a couple that are coming that we're really excited about is, again, this is us listening to our partners. We had several partners come to us and say, we're providing a lot of remote learning. People are coming to us for internet access that don't have access to it in their homes. And we're doing okay within our facility. But what we what there is a growing need for is to expand that community Wi-Fi outside their building to allow even more access for whether it's students who are continuing to do remote learning or again, folks that need help accessing social services, accessing workforce development opportunities. So we will have a grant coming out. It's in its final review as we speak to allow nonprofits, local governments, K through 12 schools to apply to expand their Wi-Fi to make it, again, for public Wi-Fi services. And the last program I want to just briefly talk about that it's coming very soon. We're in the final stages that the Board of County Commissioners approved a few weeks ago in our CARES plan is a focus on workforce development. And we looked at this program. This was not originally in our plan, but I think it was in June or July. Our unemployment rate in Hamilton County was over 10%. I think it was 10.9%. And we realized we need to provide some assistance here. Like many counties are doing throughout the U.S. So thanks to our team at JFS, they've helped us tremendously on this program. So we have a couple ones that we'll be launching. One is we have many training providers in our community to help people that need to get trained for new jobs. And there's a tuition for those programs. So we are going to work with those providers to provide for students that are currently enrolled or may want to enroll but have lost their job, had a loss of income due to COVID-19, we will provide a portion of their tuition assistance. We're again grateful to get that program launched and going to help folks redevelop their skills and get new jobs. And the second one was actually an outgrowth of our rental assistance program. We had, according to one of our providers, we had residents who were calling for rental and say, I lost my job at X restaurant, and how can I find a new job? And so what this is lovingly referred to is the Rapid Reemployment Program that we're finalizing right now, which will provide coaching, resume building, skills assessment, financial financial planning to residents that, again, have lost their job due to COVID. This will help them find jobs that are out there. And we are working with several partners on this program. More to come. Hopefully it'll be launched very, very soon. So that is a lot, I know. Sorry for the speed at which I went through that, but there's so much good stuff that we're trying to get out as quickly as possible in order to help all Hamilton County residents that need it because of this pandemic. With that, Commissioner Driehaus, I'm happy to expand on anything or answer any questions.
Thank you, Holly. And as Holly said, there are many partners throughout the community that are helping us with these CARES Act dollars to make sure that we're hitting the mark where the need is. But there's also an internal team that has worked 7 days a week, night and day, to get these dollars out, because remember, we're fighting this deadline at the end of the year, and so we do not want to leave any of these dollars on the table. So thank you, Holly, for all that you have done, and Bridget Daugherty's part of that team, but there's a very large team that's been helping pushing these dollars out. And I do want to note that the team's been very flexible, as we have heard from community members about needs, whether it's related to jobs where an arts facility has been shuttered, whether it's related to access to Wi-Fi, which we were worried about. We can only do so much, again, because of this deadline at the end of the year. But this expanded access to outside of a library, for instance, or a rec center, where we're encouraging people to congregate outside, or rather be outside, not in a building. We need access to Wi-Fi then outside that building. And so that's really what we're trying to do here. And then the workforce piece is critically important. And that is something that we've been recently made aware of and said, wait a minute, there's a need, how do we address it? So that's really been the crux of the program. So thanks so much. All right, so that's what we have. I know we've gone a little longer than usual, but I think it's been really useful information. So Bridget, I believe we're ready for questions.
Our first question is from Chris Wederick for you, Greg.
Good morning.
Good morning, Greg. I want to get a little bit more clarity from you on mask compliance. I mean, when you showed the chart earlier about our cases spiking, since the mask order went into effect, cases went down. Are you completely convinced that our mask wearing compliance hasn't gone down? And second to that, I mean, you also talked about how people are congregating inside now with family and friends and whatnot. I mean, should people wear masks in those situations, or should they just not have those gatherings?
So to start with the first part of the question, anecdotally, if you were to go to the grocery store this weekend or out shopping, when you look around, almost everybody from employees to customers are wearing masks. But if you take time and you play on your social media for a few minutes, or you go to an event that's outside, we just see significantly less compliance. And that's not just here in Hamilton County, that's other places too. When you're outside, we tend to let our guard down. You hear the logic that outside kind of keeps the virus away and there's more air and it can disperse. But the truth is, if you're close to people, it allows for the spread of COVID-19. When we start to move inside, or when we start to have friends over for campfires, it's healthy. We need to have social interaction. But if you're letting people inside of your bubble that have not been part of your household or part of your group, you are operating with new exposures to COVID-19. And I know in Hamilton County, some of us are going to take this perfectly seriously and not going to bend the rules at all. Others need that social interaction and are starting to let their guard down and starting to bring people back together. I would encourage you, if you're gonna break that circle, I would encourage you to wear masks inside, and if you're outside and you can't space, I would encourage you to wear masks. That's how we control COVID-19.
And then another question: the city has had some of its contact tracing results, and it's rated various things from either a percentage or a numerical count. Does the county have a chart like that somewhere where you can? I mean, I think, for example, the number that sticks out to me was the city showed that 14% of the cases that it had traced were from schools or daycare, or I think those were the main items. Does the county have something like that? I know that you said that it's just a variety of things that are where these cases are coming from.
We do not have something pre-built like that. I will talk to my epidemiologists and see how easy it would be to recreate what the city has and try and keep it consistent. So I'll have to look into that a little bit more and get back with you.
Thanks. And then one last question before I go. I mean, when we get to Thanksgiving and Christmas, I mean, Halloween, it's an outdoor thing, and it's still relatively warm, I suppose. But if Thanksgiving and Christmas are cold weather events, should people plan on celebrating those or skipping those this year, do you think?
The truth is, it's really no different than what we were talking back when Easter was here and some other earlier spring holidays. COVID is still here. There's no vaccine. If you feel like you must get together with family and you're not willing to sacrifice this holiday and you've had enough with COVID, I would really encourage you to do so with masks. Consider social distancing, and really, maybe if you used to have 30 people over your house for Thanksgiving, maybe consider limiting the number. Ultimately, the best solution, though, continues to be social distancing, but I understand some folks are getting fatigued with COVID-19. So we just really want to continue to encourage wearing those masks. Right now, we know it's community spread. I just shared the numbers. We know there's more cases today than there were last week or a month ago. And that just increases the opportunity for spread when you bring 10 people into your house.
Thank you, Greg. I appreciate it.
Absolutely.
Our next question comes from Jay Hanselman from WVXU. He wrote in for both you and Denise. In the early parts of the pandemic, the curve was flattened with essentially large parts of the county and the economy shut down. If that worked then, as officials suggested at the time, why is there no move to do that again? Are you fearful that people will not cooperate with another stay-at-home order?
Thanks, Jay, for the question. In March, when we here in Hamilton County started acting upon the governor's state orders to shut down businesses here in Hamilton County, we had a lot less knowledge about COVID-19. We had very little by way of treatment, and we had very little protective equipment for our hospital workers, our police, and our firefighters, meaning we were asking these individuals to go into the community, risk their lives for us because of COVID-19. We did flatten the curve, and it was very successful, and we were able to make sure that we have protective equipment for our police and fire. Real quick, if I could have you pull back up the slide that shows cases in Hamilton County. When you look at June, when things started to open back up, that's the curve we're talking about. We're talking about March to June. Here in Hamilton County, we were successful. Our lockdowns worked. We flattened the curve. You can't help but notice the mountain. The mountain starts in June and it climbs, and it goes all the way until July 8th. I took away the big red line, but there's still the graphic of the masks. Here in Hamilton County, we were successful. We flattened the curve with masks. We flattened the curve because we worked together. As a community, we did this. And so as we're trying to make decisions, we know that COVID-19 and we know the economic impacts had a lot of public health implications for families. But we know as a community, we can put masks on and make a difference here in our community. So as we're trying to make policies and decisions on how we flatten the curve this time, I looked at each of us as individuals and to take personal responsibility so we can flatten the curve again without taking more drastic actions. We can do this with masks. We've learned a lot about this virus, and it's really up to each of us.
Well, I just want to say ditto to what Greg said. I mean, you know, like you said, Greg, we've done this before. The first time out, the governor made a decision about shutting down businesses because we really didn't have enough knowledge about what we were looking at and what a good strategy would look like. Then, following that, the mask mandate came and is still in place. That also flattened the curve. And so I think that the hope is that we don't have to go back to shutting down schools, to shutting down businesses. It's so disruptive, and I think all of us would like to avoid that. But the way to avoid that is to wear a mask and to avoid these settings that both Greg and I have talked about, where people are congregating and not wearing a mask and not staying safely distanced from one another. So it's within our control to do this. We just have to remember that these strategies work, and all of us need to implement the strategies.
Okay, thank you. Just one more moment to see if anybody else has any questions. And that appears to conclude the questions from reporters.
Okay, thank you. I once again want to thank Greg, as always, for being here. Your expertise is invaluable. And Holly Chrisman, Assistant County Administrator, for giving us a really important update on those CARES Act dollars. So thank you all for joining. Thank you again to Jay and Vicki. Jay's gotten a bit of a workout again today. So thank you all for joining. We'll be back next week.